Okay, so we have now the second half of this specific conditions lesson that we're going to go through. This one is going to be a little bit different. We're going to have a bunch of small specific conditions, as far as like there won't be a lot to add or discuss with each one of them. So it's really just going to be kind of highlighting, making you aware of this. There's not even going to be a lot of treatment or different aspects with that. It's more of an awareness lesson than coming together with the end with asthma. So the first specific condition that we're going to look at is allergic reactions. And so we've looked at this a little bit before as far as allergens, right? Is going to be any sort of substance that causes that allergic reaction, and that allergic reaction is just the response to the allergen. And we're most concerned about this when it becomes an anaphylactic reaction, where we get a drop in blood pressure because of a systemic vasodilation, right, with that, and it can affect airways and different components. You can see signs and symptoms of allergic reactions listed here. Depending on whether it's more localized, you may see those reactions more in the skin. And if you get into a more systemic aspect, you can see things as it goes down and becomes more problematic. Treatment for allergic reaction is first and foremost going to be removal from the allergen, right? Washing the area thoroughly if possible, removing the stinger if there's a sting injury associated with that. But if we're getting this allergic reaction, our main thing is going to be administration of epinephrine, right? And the EpiPen is our typical way of doing that. And you'll look at that in lab. Next is ingested poison, right? Any sort of contaminant that's administered by mouth that causes a reaction is going to be in this ingested poison category. Our main thing is going to be determining what was taken and when, and then the Poison Control Center is helpful with that. So signs and symptoms, you can see here abdominal pain, nausea, vomiting, or diarrhea being most common as your body tries to eliminate the poison with that, but you can see it can get into some difficulty breathing and confusion with that. As I said, management is basically determining the type of poison and monitoring the vital signs, and then the Poison Control Center with that. One of the things that we will look at specifically is activated charcoal when we look at ingested poison in some of the other conditions that we'll come back to. An inhaled poison then is similar, but it's fumes or gases with that. Signs and symptoms are going to be more respiratory in nature because it's inhaled, and so the body is taking the poison in through the lungs opposed to the GI tract, so we'll see more respiratory symptoms. Management is going to be this fairly similar, determine what's inhaled. If the poison is airborne, obviously that would be an unsafe scene, and so you're not going to approach that scene, just activate EMS. Otherwise, similar, contact the Poison Control Center. They'll talk you through different aspects and you're going to refer as needed. You can also get an injected poison here, and this is where it's injected through that, either through illegal injections of chemicals or like a poisonous injection from a snake or aspect. You can see signs and symptoms. The new one there that we will see is pain or soreness at the injection site. You can see, depending on the poison, shivering or fever might go through. Similar aspect to determine what poison was injected, monitor vital signs, contact poison control. All right, lastly, in there, absorb poison, anything through the skin or cell membranes. You'll see irritation at the site, can progress all the way to difficulty breathing. Same aspect, you should be getting relatively familiar with this. Remove from poison contact poison control. Remove clothing around that because it's absorbed and the clothing may actually have some of that poison in there. And then flush area with copious amounts of water. A specific type of allergic reaction is poison ivy, poison oak. This is allergic dermatitis with that. It can be caused by a variety of different things, but it's going to be direct or indirect content with the chemical that comes from the oil or sap in the leaves and stems of these plants. And symptoms usually appear 24 hours after exposure and resolve in about 2 weeks. Signs and symptoms there, you can see aspects. Redness, itching, swelling with that. There can be difficulty breathing if it's inhaled with that. Soap and water, removing the contaminated clothing. Calamine lotion, Benadryl, or hydrocortisone cream can alleviate some of the discomfort there. Insect bites and stings. Primarily talking about wasps and bees and fire ants. With that, wasps and bees can have a normal, just more skin level aspect and irritation at the site of the sting. In some cases, you'll get an overactive histamine reaction that can cause anaphylaxis with that. Fire ants are usually associated with this arc-shaped lesion and similar redness and swelling at the area of the bite. Management, remove the stinger if present with an object and how to do that. You try not to touch or scratch or rub those skins as you can spread the injected poison. Topical steroid or antihistamine if not allergic. Cold compress can help decrease the pain, and an EpiPen if they're allergic to that and they're at risk for anaphylaxis. Another specific one to talk about are ticks because of the prevalence and the ability to transfer Lyme disease. When we look at now ticks, obviously the signs and symptoms for ticks are just the presence of a tick. But otherwise we're looking at Lyme disease with that enlarged red rash, headaches, muscle and joint pain, fever associated with that. That's all sorts of things to go looking for ticks there. The treatment is going to be removal of the tick. Grab the tick as close to the skin as possible with a blunt angled forceps. You pull up on the tick, not twist, with a steady amount of pressure. Wash the area thoroughly and apply an antiseptic ointment. You don't want to squeeze the tick's body or whatever because you can be at risk of breaking off the head. Petroleum jelly, match, or alcohol can be used to kill the tick prior to removal as well. With spider bites, we're primarily concerned with the brown recluse spider with that, as you can get a specific reaction here with that's characterized by a dusky, shallow, open sores with that is characteristic of that brown recluse spider bite. Otherwise, with spider bites, you're going to see normal itching, redness, swelling with that. This obviously is carried over. It's not tick removal, but instead the spider. Identify the type of spider, remove, and treat the discomfort as much as possible. For scorpions, there are 40 different species of scorpions in the U.S. They do inject a potent neurotoxin with that. Some of the signs and symptoms are obviously pain, but depending on that, you can have muscle spasms, excessive salivation, slurred speech, different aspects. Remove the stinger if present. Wash the area. Similar things: topical steroids, antihistamines, EpiPen if allergic, and monitor for infection. When we get into snake bites, there are obviously the seriousness and the symptoms are going to be based off of the type of snake, the location of bite, the amount of venom ejected, and then the overall health and size of the person. when you look at the different signs and symptoms with that, they're going to depend greatly on the type of snake and thereby the type of neurotoxin. Again, similar aspect. I try to identify the type of snake. Latex allergy, about 5 to 10% of the general population with that. You have two different types. You have an irritant contact dermatitis, which is just more local, dry, itchy skin. Allergic contact dermatitis will appear later, about 24 hours after exposure. And then you can have hypersensitivity that causes more widespread things. Remove the exposure risk, wash hands, topical steroid, and then refer if symptoms worsen. So moving right along there to exercise-induced anaphylaxis as we get into this area, most commonly related to ingestion of different foods or medicines associated with that. You can get anything from hives with that to choking sensations. Symptoms usually occur about 10 minutes after exercise, can last up to 4 hours. We're going to treat and maintain the airway, administer epinephrine with this because it's an anaphylactic condition and if they have airway disruption. And then you're going to decrease the intensity or duration of exercise, and the hot, humid environments tend to be a trigger, so we can avoid that. So our last specific condition we'll look at is asthma. There are different causes with that, exercise-induced asthma being very common, but there are environmental conditions that also can cause asthma. The signs and symptoms are the telltale wheezing as it becomes difficult for them to exchange air. For the diagnosis, we're looking at our family history of that, and then we can assess their baseline peak expiratory flow with the peak flow meter. Our general treatment with that is going to depend on how severe it is. So if they are in severe respiratory distress or respiratory failure, right, with that, we're going to first immediately contact 911. If it's just a difficulty breathing, we're going to measure that peak expiratory flow, and if it's below 15% of baseline, you use the inhaler. If after that it returns to baseline, we can return to activity but monitor that. If not, we're going to administer the rescue inhaler again and check. And then if we need to use, if after 3 uses of the rescue inhaler we are not getting good results, we're going to immediately refer to another medical facility. So that's our basic, very quick introduction. You'll look at these more with your textbook spotlight quizzes as well as different readings associated, but just want to give you a quick update and overview of that. As always, if you have any questions, let me know.